Good morning, afternoon, and evening, everyone. Welcome to the second virtual dialogue on tobacco control and cancer. And today we will explore how our communities could work and learn from each other, actually, to drive policy change for tobacco control. So before starting, actually, our presentation today, I will just remind you a few ground rules, actually. So unmute yourself only when you're talking, please. Camera on if your connection allows. Open the chat box and make full use of it and ask questions either to the speakers, to the moderator, or to your peers online. And get your phone, actually, for an interactive event. So we will discover that in the next few slides, actually. So today we will welcome our moderator, who is Anka Thomas. Anka is the director of the Smoke-Free Partnership, a Smoke-Free Partnership since 2018, and she's working there since 2012. But I will make it short, actually, because Anka is a well-trained and experienced advocate working on tobacco control and various health areas. So we thought that she was the perfect person, actually, to talk about capacity building for tobacco control. Anka, the floor is yours, and have a nice event. Thank you. Thanks a lot.
Thank you very much, Yannick. You create expectations from me right now, but okay, let's see if we can raise the bar. There's never enough capacity and there's never enough training. And I think that's precisely why we're having this dialogue today. So it is my pleasure to say good morning to everyone this morning in Europe, very early morning in the Americas, morning-ish in Africa, and late into the evening for some of our speakers. So thank you very much to everyone for joining us today. It is my pleasure to introduce our panelists today. I'm going to start with Kylie Lindorf, who is the chair of the board of the Framework Convention Alliance. And she is, well, I think Kylie is well known to probably most of you here. She comes from Australia. Her day job is in the Cancer Council Victoria, but she's here today representing the FCA. Our second speaker is Sua John Ryan. John is the CEO of the Samoa Cancer Society and very recent, on behalf of the Cancer Society, recipient of the World No Tobacco Day Awards of this year. Also with us is Rachel Devotsu. She's the regional manager for Africa at the McCabe Center for Law and Cancer. And another World No Tobacco Day Award recipient, but from last year. With these introductions, welcome Kylie, John, and Rachel, and let's get this dialogue going. We're here to talk about capacity, and in preparing this dialogue, we wanted to establish a little bit what we mean by capacity in this particular context, and what we'd like to know about capacity building in the context of tobacco control. So capacity, as I go through this, I would kindly ask you to open a browser window or something on your laptop, on your smartphone, and go to menti.com. We will ask a few questions that we'd like you to answer in real time, so that we can discuss your views in real time. What is capacity building? It is the creation or the improvement in an individual or an organization's ability or facility to produce or perform or deploy. And in the context of tobacco control, it's the ability to create or use the opportunities of improving awareness, of changing behaviors, or developing policies. These are fairly general headlines. It's also about the knowledge and ability to identify appropriate solutions at the right scale, and and the roadmaps towards achieving those solutions. And of course, because here we are, we're all representing civil society organizations, we're also talking about capacity in a sense of long-term organizational continuity, stability, and sustainability, which includes funding, but it also includes human resources and staffing. So I would like you now to go to menti.com, and thank you very much, Alessandro, our most wonderful helper today. He's put in a code for Menti, and we'd like to ask you one question. If we can go to the question, please.
Thanks, Anka. I've put the code. So if you go to, as Anka says, go to menti.com either on your phone or your computer and enter the code 66494180. I also posted that in the comment box. You should be able to see a question at the moment, which is a very simple question, just to getting the pulse in the room to know if the organizations present here engage in advocacy for tobacco control policy change in your country. So I already see some questions coming through, and keep answering them. And in the meantime, I will soon share the screen so we can have a look at the results. Just a few more minutes to make sure that everybody's had the chance to enter their response. Again, go to www.menti.com. You can also see it at the top of the screen and use the code 66494180. We will have another poll later, and the method will be exactly the same. I'll leave sharing the screen, and maybe I'll let you, Anka, start commenting on the results as they come in.
Thank you.
Soon have numbers.
Thank you. Thank you very much for answering the questions. Keep answering this one as we go with our conversation. So I've introduced a little bit the topic, and we see that a lot of our respondents, a vast majority of our respondents are engaging in advocacy through policy engagement. So in my head, this is called lobbying, but let's just call it political advocacy. This is a question to our speakers. Why do we need capacity for tobacco control in a political advocacy context? I would start with Kylie, starting with a more global perspective from the FCA, and then I would ask Rachel to give a regional perspective, and then John about his daily life in Samoa. Kylie?
Thanks very much, Anka, and good evening, everyone, or it's evening in my part of the world here in Australia. So yeah, a great question. Why do we need capacity building in political advocacy? And I guess particularly from a policy perspective, it's because much of what we need to do in tobacco control is legislatively based, and it's the politicians that make decisions on that legislation and what we need to do. So we really need to understand how that works at the national level. We also need to understand how that works increasingly at the international level. And obviously what we have, what we're lucky to have in tobacco control is a global treaty on tobacco control. So we've got the WHO Framework Convention on Tobacco Control, which is a public health treaty which governments sign up to, basically to commit to undertaking tobacco control in their countries. And that's where our organisation, the Framework Convention Alliance, or FCA, fits in. So we've been engaged in the FCTC since its inception, or prior to its inception actually, since it was started to be negotiated, once it came into force. And civil society is incredibly important in tobacco control, because we're normally the ones that are working in this space day in and day out. And politicians come and go, often public health or health bureaucrats come and go, government in departments of health, but it's often us as civil society that are there and keep that momentum going, keep the knowledge going, and really keep the pressure on those as they come in. So the FCTC is really important, both for those countries that have signed up and those countries that perhaps haven't signed up. And civil society is there to help the FCTC be implemented and to help keep governments accountable. So we go along to the Conference of the Parties, which is the negotiating body for the FCTC. They're held every 2 years. That's where a lot of the actual decisions are made, but there's a lot of work happens in between those COPs, those meetings, and that's where the FCA really focuses on the national action and getting things happening at the national level. We've got a member network of 300 members in over 100 countries. And one of our roles is to really have those networks be able to talk to each other and learn from each other and build capacity that way, to understand what worked in some countries, what lessons have been learned, how do we get politicians to act, what's the evidence we can share across countries to use in our own country. And we also build capacity through things like webinars, training, things like that. So, you know, it's capacity building from that political point of view, as I said, is really important, because many tobacco control measures require political will, they require political action to come into force. And the bottom line is we need capacity, because the tobacco industry aren't going away anytime soon, unfortunately. There are those of us who have been in this game a long time. Many of us, I'm not yet, but many people are coming up to retirement or they're moving to other spaces. The tobacco industry aren't retiring, unfortunately. We need to make sure we have that capacity, we keep building on it. We've got a big job to do still. I'd like to say that we've done ourselves out of a job, but we haven't just yet. So that's sort of introductory comments. I'll stop there and let others speak.
Thank you, Kylie. You've made a really good overview about the way the international level reflects on national advocacy and on the needs and ability to develop capacity. I'd like to move to a regional level and ask Rachel, who runs the African coordination for the McCabe Center. How do you see capacity building for policy at this regional perspective, and where does it fit in between the national and the international?
Okay, so good morning, everybody. Greetings from Nairobi. At McCabe Center, we largely train government officials on how to adopt and implement NCD legislation. We focus quite a bit on tobacco control, but we also do a bit of training in the areas of alcohol and food, because all of them, unhealthy food, are risk factors for cancer. But also prior to working at McCabe, I worked at the regional level, building capacity in 10 countries in Africa. And so I'll just share a bit about what I've come to realize about the need for capacity building. So starting from the perspective of government, as Kylie said, unfortunately, government officials tend to move around a lot. And so, for example, here in Kenya, some departments have a policy that they move people after about 3 to 5 years. So you get a very high rate of turnover, and therefore a lot of capacity gets lost. And so you train people, and then after 3 to 5 years, the bureaucrats have been moved to a different department, and you get a fresh set who need fresh capacity to be built again. From the perspective of members of parliament, again, every 5 years there's elections, and for example, in my country, about 60% of the members of parliament get voted out each 5-year cycle. So again, you've spent time building champions, educating them, getting support for things like tobacco taxes, and then after 5 years, they get voted out. And so I see this happening a lot, and so that's why there's need to continuously build capacity. And unfortunately, from a funding perspective, because a lot of tobacco control programs in Africa are not government funded, they are donor funded, they don't have a capacity building budget. And then when you look at it from an enforcement perspective, so the police officers and other enforcement officers who have to enforce the laws on the street, again, you train some and then they get transferred to another part of the country, or they retire, or things just happen. And so there's need for regular capacity building, but not a budget for it. And so very often we as civil society come in and we raise funds and we hold a training and we report that we trained 100, 200, 1,000 police officers or 1,000 policy makers. And then we tick a box and say, been there, done that, we've trained capacity. And then after 3 years, there's a shift and people have moved. And when we come back to our funders and say we need to do fresh capacity building, unfortunately, capacity building is a bit of a dirty word. And so they're like, but we just trained capacity, we just trained people 3 years ago, why do you need this again? And so without sustainable funding at the national level, so that government can routinely train its own officers, you then find that you then get a fresh set of people that need capacity. Then just touching a bit on what Kylie said about the Conference of the Parties. So I found the COP to be one of the best places for training for government officers, just because the Conference of the Parties is at the cutting edge of what is happening in tobacco. But again, in Africa, where I come from, again, because of a funding issue, typically WHO pays for only one ticket. And so that tends to be somebody from the Ministry of Health. And so when you're looking at building capacity across other government departments that are necessary. And so if, for example, you're talking about tobacco taxes, you need Ministry of Finance to be on board with it. When you're talking about dealing with tobacco industry interference, you need the Ministry of Trade to be attending ministries, or many other ministries. Sometimes you need even the Office of the Attorney General, because these are treaties that we are talking about. And so when you expect a country to come up with 4 tickets and only one is sponsored by WHO, you find these other departments do not come to the Conference of the Parties. And so when we come back home and we try to hold a dissemination meeting to basically share what we learned at the COP and what was adopted, you find that some of these departments don't even want to come for those meetings. And so tobacco control is seen as a Ministry of Health thing, yet it's very multi-sectoral. And so still at the level of capacity building, there's a big need to build capacity out of the Ministry of Health, particularly in Africa. Just before I end, turning to civil society, I think one of the challenges we have is building depth. And so we have a lot of civil, passionate people. And so many of the tobacco control NGOs started off based on the passion of one person. And Kylie mentioned the challenge that as we grow older, some of us are retiring or we move on to other things, there's the need to train younger people so that they can take on the fight after us. And so how to transform organizations from being built around a person to become institutions. And so when I look at the big NGOs in the West, so I'm looking at Cancer Council, where Kylie comes from. Incidentally, McCabe Center is also based there. So, I mean, I've been there and it's a big organization, but you're looking at NGOs that have got maybe 1 to 5 members of staff and not only working on tobacco control, could be working on other things. And so how do we build the next generation of leaders so that even as some of us leave, there will be others to continue. So that is the scope of the problem. And then I think the last one, particularly for us here in Africa, is that a lot of the tobacco control NGOs are not cancer control NGOs. So there seems to be this disconnect between the Cancer Society and so them dealing with it from the disease side of it. And so they're dealing with patients, they're dealing with access to medication and not engaging in advocacy on risk factor advocacy. And then the tobacco control NGOs that come in from the risk factor perspective, but forget that the reason we are dealing with tobacco is because it causes cancer. And so when we're looking at building alliances and coalitions, how do we rope in the disease-specific NGOs and the risk factor-specific NGOs so that you build a stronger coalition and then be able to transmit knowledge through them? So I think I'll stop there for now and allow someone else to say something.
Thank you so much, Rachel. You've raised such a wide range of interesting questions. But I'm going to ask a similar question first to ask John. And perhaps because we've talked before, and I know that the Cancer Society does a little bit of everything in Samoa. So would you like to give a more local and a more national perspective on what capacity building is and why it's needed for tobacco control, and in what form?
Yeah, thank you, Anka, and good evening from Samoa to everyone that's listening in tonight. So I think to put into perspective, just so everyone, I'm sure most aren't aware of where Samoa is or exactly who we are. So Samoa is a small island developing state in the middle of the Pacific of about 200,000 people. And this comes with its challenges in that capacity is always important. The previous speakers have raised very important points on capacity and knowledge sharing that we have locally. And it's amplified even more in small states like ours, where there's a limited pool of resources that we can call on. So from our local perspective, we're always looking at what's being done regionally first and then internationally to draw on. So we're not reinventing the wheel. So we're not using up vital resources, trying to develop what has already been done elsewhere. So for us, it's very important that we look to what's being done regionally and internationally, because what we do locally, as you shared, Anka, is that Samoa Cancer Society, we do a little bit of everything. We advocate for all cancers, but we're also heavily involved in tobacco control. And as has been mentioned previously as well, we do have a limited pool of resources, not only in civil society, but also within governments and within our government and within our bureaucracies, where people tend to move around. So it's ensuring that there is a knowledge base and that there is a transition of information to those that are coming after. One of the things that we were successful in doing for the Samoa Cancer Society was having Samoa Cancer Society legislated as a full-time or permanent member on the National Tobacco Control Committee for the Samoan government. So this is actually legislated in law now that we're always going to be a participant in, which is fantastic. Because previously it was on an ad hoc basis where they'd call on us when they had no one else. So by doing this, we've now got our foot in the door where we can develop cancer champions within the bureaucracy of government and even within politicians themselves. So when we look at what we do locally, it's not just developing policies or advocating as such, but it's also building coalitions, as has also been mentioned, because we have such a small group of people working in the space. We can't afford to work in silos independently. So we have to reach out and work with all those around us. And sometimes we have to be very creative in who we're reaching out to, and find the synergies in everything that we all do in the house space. So maybe I'm not talking to people that are directly related to cancer, but we can find ways of how we can link everything together, especially when there's a limited resource as well when it comes to funding and it comes to capacity building resources that are available. So from our little small island state of Samoa, this is how we've managed to work so far. And, I'd just like to extend like a big word of thanks to being involved in this discussion, because it's just going to, again, open up more doors for us in moving forward for tobacco control.
Thank you. Thank you very much, John. I have a spontaneous question. Do we need any specific skill set as tobacco control advocates to build partnerships across different disease areas from a risk factor perspective, or is that does that require any specific skill sets? What is your view? And perhaps I would start with Rachel, because she's the first one who raised this.
So I think for me, I see the natural vehicle being the NCD Alliance, which UICC is also a party to. And I think in very many countries, there are local chapters. And I think the first place we all have to start is asking why we do what we do. And so if you're a cancer society, obviously you're interested in reducing the number of cancer cases and helping the cancer patients. I mean, so you want to turn off the tap and then deal with the ones who are flowing through the tap. And if then you appreciate that if you don't then address risk factors, then you're not going to turn off the tap. So you'll always be the bucket that's collecting the water coming through the tap. And I think you've got an interest in trying to turn off the tap. So then that leads you to reach out to the people who are working on risk factors, because this is one of the things that will help to close the tap. Now, for those of us who are closing the tap, so we are dealing with risk factors, then we need to appreciate that the reason we don't want any water in the pipe is because it causes diseases. And so when you come to the NCD Alliance and you've got cancer, you've got hypertension, you've got diabetes, which are all the diseases that come from smoking, from an unhealthy use of alcohol, from eating unhealthy food, then you would think that automatically we would see that we've got common ground. But very often, because as John mentioned, we think in a siloed manner. So on one hand, your proposal comes in as either a cancer proposal or as a tobacco control proposal or an alcohol control proposal. And so you fail to see the need to reach out to those other people. And so if there is an NCD Alliance where all of us are meeting or connecting regularly, then for me, that is the easiest place to be able to bring everybody together. And then what I find particularly, say, in Kenya, and I've seen some of the other NCD Alliance meetings in Africa, is that then still the disease organizations are still very heavily focused on patients, which is important because patients are the face of the problem. But they need, I think, just to really try and rope in the risk factor people. So for me, I would see that the skill set is really just appreciating that we all need one another and deliberately making effort. And so when there's a tobacco control bill going through the House, do we invite the others? When we are doing our press conferences, when we are doing our advocacy, so on World Cancer Day, on World Diabetes Day, on World Hypertension Day, there are so many days. And so if we would see that all of these are opportunities and platforms for each of us to get what we want through the door. So there are some things that are common and some things that are different. But if all of us came together, we would be able to get some of these things. And even when you look at the issue of funding, which John has mentioned, all of us obviously need more money than we have got. And the obvious sources of funding are taxes. Now, unfortunately, the taxes are leveled on the risk factors. So the taxes could be tobacco taxes, they could be alcohol taxes, they could be sugar sweetened beverage taxes. All of these are risk factor issues. And so if you don't engage the communities that are doing the tobacco control advocacy, the alcohol control advocacy, the food advocacy, yet we are seated here crying that we don't have money, and that is where the money is. And once this money came, it would solve all of our problems. And so I think just reorientating how we think about our issue, and as John said, not being siloed, so that we make a deliberate effort to reach out. I think that's really just the skill set.
Thank you. Again, excellent points. How do we advocate for, I think one of the challenges for, tobacco control advocacy, especially in a disease-specific community, is the fact that tobacco control is about dealing with a problem before it becomes a problem. And I'm just wondering from that perspective, and I'm targeting this question at John, how do you approach that? Because of course, disease-specific organizations, they have a duty to their patients. It's normal, but how do you manage to redirect attention also to the tap, as Rachel, you were you use such a plastic metaphor to describe it. How do you how do you address the problem before it becomes a problem? John?
Yeah, sorry, I'm still here. I had to kill my video feed because my internet connection is not stable at the moment.
Of course.
But yeah, it's always a challenge, and the only way we've managed to do it successfully locally is by building coalitions and everything that we do. I'll give a real life example. One of the activities that we've had locally is what we called our Butt It Out campaign, which was collecting cigarette butts to prevent environmental damage. So that included reaching out to environmental groups that wouldn't necessarily be looking at tobacco control. But because we targeted the environmental impact of having cigarette butts disposed of incorrectly or just thrown on the ground, it's brought in different players now, different actors into our tobacco control advocacy. And the more voices we have, the stronger it becomes. So it's approaching it from many different angles. Before we started to do this, it was very difficult just trying to do it on our own as a small voice. And again, in a bureaucracy that's, in fairness to our little government here, they only have a limited pool of funds. So within our health department budget, they're very reactionary into whatever the next issue that comes up or the next challenge. For instance, COVID-19 now is the main focus. So we really need to build coalitions to constantly keep tobacco control in the main sphere of conversation, because otherwise it just gets pushed into the background as governments focus on the bigger issues that they might think are there. So having a broad-minded approach, taking a little bit of a holistic approach to how we do things has really helped everything that we've got.
Thank you. We have a question in the chat box from Ekundayo Samuel. What he says is, we are an organization advocating for cancer prevention and control in Nigeria. We focus on the underserved rural communities. How can we get involved in tobacco control advocacy? And I think it's a perfect question for this dialogue, because it's very practical. So there we have an organization who wants to do tobacco control advocacy. What should they do, Kylie? What are they supposed to do?
They could join the FCA. That would be a great start. Look, I think it does come back to that capacity. And I guess being networked means you can call on people that have done this stuff before, and you don't have to start from the start, and you certainly don't have to reinvent the wheel. So, yeah, absolutely. I was being a little bit silly, but join the Framework Convention Alliance. So there are so many. We have, I don't know how many members in Africa, probably hundreds. Africa has really strong tobacco control NGOs and NCD NGOs, and Rachel would know more about that on the ground than I do. But don't feel like you have to do it on your own. I think reach out, find who's working in your area, find out what the community wants, find out where your blocks are with politicians, and then just ask lots of questions. There are no silly questions. There's a lot of help out there. There are websites, there are resources, there are individuals you can be put in touch with. So it's great that you're on this forum. You are going to make lots of connections just here tonight alone, and it's just asking for help, really, and knowing where to go.
Thanks a lot. I think we get to a point where it's a perfect time to go to our next question for Menti.com, because it really is it's a very practical question about where are the gaps in the skill sets, and what kind of skills participants in this dialogue see a need to develop. So please go to Menti.com. I'll pass maybe to Alessandro, because he explains it a lot better than I do.
Thank you, Anka. I'm just going to post again the link to the poll, which is the same as before. If you go to menti.com, you can see it in the chat box and use the code 66494180. You should be able to see a question, which I'm going to share the screen just now, so you can also see it here. So Anke's introduced this question around what skill sets are useful for collaboration, but also we know that lobbying or political advocacy, it's truly a multi-skill set undertaking. So we want to know, obviously there's many organizations doing it, which of these skills that you see here are those where you think your organization is most in need to build capacity in order to be more effective in its advocacy work. We're asking you to rank, obviously, you can rank up to 6, so just the top 3 that you think are the skills most in need for your organization to be more effective. So maybe just giving a little few more seconds for people to answer. Again, go to menti.com. 66494180 is the code. You can use your mobile to do it.
Thanks a lot, and thanks a lot for answering, everyone. The answers are still a little bit evolving, but I do see that at the top, the first and second are fairly general skills on understanding political advocacy, which includes, understanding processes, knowing when the right time, right place to be in advocacy is, how to understand and use public opinion data on influencing policymakers. The second one is PR and communications. So that's a skill that is seen as needed, but then very, very closely behind are the more technical skills in law and policy and in science and in economics. And then there's a few other answers, and I'd be very curious if you've typed other as a need, then do give some examples in the chat box. I think it would be quite interesting. I'm looking through the chat, and I see there's a lot of comments about tobacco control should be a multi-sectoral issue. We had some fantastic news from the Netherlands where the parliament is due to include Article 5.3 of the Framework Convention on independence of policymaking from the tobacco industry as a requirement for elected parliamentarians. We have news from Scotland on the NCD Prevention Manifesto for the Scottish Parliament elections of this year. A more acknowledgement of the multi-sectoral nature of tobacco control. And we have a comment from Pakistan. I'm sorry, all I see is the letter M as a name, on the question of a disconnect between cancer societies and tobacco control agencies. A CEO, oh, hello, Mariam. She is from Cancer Hospital, and the CEO advocated for a cancer tax in Pakistan to address the bridge to address that disconnect, to discourage tobacco users from smoking, but at the same time to fund cancer hospitals. So it's a health levy, a sin tax. And actually, that's something that I was going to ask our speakers of today, how to develop the capacity in the cancer or NCD or tobacco control communities to support sustainable policy change. And in particular, why is tax so important? And I'd like to start with Kylie at this point, because well, FCA is doing a lot of work on tax capacity building, but I'd like to hear from all of our panelists today. So Kylie, over to you.
Thanks very much, Anka. Yeah, FCA is doing quite a bit around sort of a budget advocacy program. So we've been doing some pilots in 2 African countries, in Senegal and Uganda, and it's because tobacco tax is, you know, when you look at the evidence base, possibly the most effective thing you can do to decrease the level of consumption of tobacco. And it also works particularly well in low-income earners or low-income situations where they're more likely to stop using tobacco. So it helps to even out some of those health disparities. The other thing, of course, is that it's often really attractive to governments because it does bring in revenue, significant revenue to them. So it's sort of a bit of a win-win. We get a public health win, the government gets a revenue win. You then have to try and convince your government to put that revenue to tobacco control or preventative health or other areas. But it's really important because governments who make these decisions around taxes, it's often the finance department or the treasury department. So you might have very good connections with your health Ministry of Health and health colleagues, and they understand the health arguments, but you need to be making these arguments elsewhere. And that's a different skill set. It's a different type of argument. They probably don't care too much about what it's happening in the health impact, other than if it's saving the money in hospitals, and you can make those arguments. So it's really important around tax advocacy to be able to talk in economic terms, know who to talk to and how to talk there. So we have been running these pilot projects. We've been connecting tobacco control economists to develop sort of national data in these countries about the costs and benefits of scaling up tobacco control, not just tax, but what you get from an economic benefit from implementing the FCT across the board. We've done in-depth training and workshops to build the advocates' confidence in using this type of data. We've produced resources, held workshops, et cetera, and we've been providing some financial support for advocacy to influence budget decisions. So that was a pilot to see how it went, and it was very much in-country driven and working with local NGOs and people there. So they've been quite successful. They're being written up now as kind of case studies. We're working to complete a budget advocacy toolkit, and we really hope to have this completed by the end of July and to have that out in the community later this year. So, sorry, I've actually forgotten what your original question was, Anka, but I guess in terms of why is tax so important, it's because it has both that huge health impact, it helps reduce disparities, but it's incredibly attractive often to government because it can bring revenue in, and you can make those arguments around where they're going to save money in terms of health costs in hospitals, et cetera, obviously incredibly important in the post-COVID recovery of all governments, that they try and decrease the burden on the health system, have some income coming in to build up health services, and also stop people being hospitalised for respiratory type diseases anyway. So really important in this current climate.
Thank you.
Did I answer your question or
not? My question is, why is tax so important? And not only did you answer it, you also emphasized that as a community, we need to learn to speak the language of tax policymakers, and that it's you also, I think, raised an interesting point that it's not just about it's not about sort of specific levies, but it's also about the structural kind of taxation of risk factors, in particular tobacco. But I guess other advocates on NCDs, even in this group, but just about everywhere, would argue that the same goes for other risk factor products.
Actually, can I just add one thing, Anka? Sorry, and it comes back to something we were talking about before. So while we were doing that training to try and upskill tobacco control people in economics and talking that language, we don't have to be the experts absolutely in this. This is where building those coalitions and reaching out to other people to help us do that. So you could reach out to your university and their economics department and say, can you come and help us make these arguments? Are you interested in public health? And all of a sudden you've got potential health economists working with you. You're the tobacco control experts, they're the economists, but you're both going in the same direction and you're both advocating for tobacco taxes to help tobacco control. So again, it's really useful for tobacco control people to have at least some understanding, but we don't have to be economic tax experts. I couldn't tell you the first thing about how Australia's taxes are structured because it's so incredibly complicated, but I know people who know that, who can help me, and I know how to make those basic arguments. So don't feel overwhelmed with that type of thing as well. That's where you reach out and you make those coalitions and you get the right people in the tent with you and you go away as a little team and advocate.
Thank you. Thank you. So that allows me to put the spotlight on Rachel. Rachel, yes, please do. Yeah, I was just going to call on you.
I just wanted to add on to what Kylie was saying, because tobacco taxes are raised or lowered every year. It's not a once-off kind of campaign. And so very often we get into it thinking, okay, I want a 10% tax increase, and maybe after 2 or 3 years you get it. But it's also one area where you're going to fight all the time with the tobacco industry. And so the minute you stop advocating, whatever gains you have made, they will claw back. And so this is one area where you need to build the capacity well, because you'll be campaigning on this issue year in and year out. We started tax advocacy in Kenya in 2014. We still haven't reached the recommended minimum by WHO, which is 70% of the packet of the cigarettes being the tax. We are currently at about 58%. And in those 3-4 years, sometimes the tax policy goes in the right direction. Other times the tobacco industry interferes and it goes backwards. And so if you're going to embark on tobacco tax advocacy, prepare for the long haul. Now, in terms of the kind of capacity that you need to build, Kylie has already mentioned the need to rope in a health economist, and I agree with her. You don't need to become an expert, but you need to understand the basics. But the other thing that you'll also need is some fairly decent research capacity, just because when you get what you want, the tobacco industry will lobby and get the tax structure changed. And so being able to understand when they make a proposal, what does that mean? And what the important figure is to figure out, when you have proposed 10% and they hit back and say, no, we want 5%, what is the impact, one, on the amount of revenue the government will get? Because most policymakers just listen to the dollar numbers. And so for us in Kenya, when point where we were getting the tax structure being changed in the right manner, the income was starting to come in, and then the tobacco industry fought back, bribed parliamentarians, and what the Minister of Finance wanted, they actually changed on the floor of the House. And so being able to quickly understand the new proposal that they had brought, what impact was it going to have, and then being able to take this to our president and tell him, look here, your government is broke, you need money. If you do what we are saying, you get X amount. If you do what they are saying, you lose X amount. So don't do what they are saying. And being able to be nimble about that. And so what helped us, because we are tobacco control people like Kylie, we don't understand the ins and outs of that, is that we reached out to the Knowledge Hub on tobacco taxes, which is at the University of Cape Town. And so going to Kylie's point around having some academics with you, and if there are none in your country, there are now knowledge hubs, and there's particularly one on tobacco tax, who you can reach out to, and very quickly they can help you put together a policy brief, which then you can use for your advocacy. So you certainly need the health economist and one who will work with you throughout so that they keep track and they monitor. And then you also have to be able to monitor the impact of your tax policies so that you can tell them, yes, it's working. This is by how much the revenue has gone up. And then when they do the wrong thing, this is how you have tampered with your revenue flow and it has gone down by this much. And then eventually from the health perspective, probably 3 to 4 years later, this is the actual impact that it is having on one, hospital admissions, two, the amounts of money being spent on tobacco related diseases, because around tobacco tax, it's not about the health arguments, smoking is bad for you. It's around what is it costing us if we don't raise the tax? What is it costing us when more and more people are smoking? What benefit are we getting when the number of smokers go down? And so you also need to be able to monitor all of those figures. And so that's the kind of capacity you need, and it is for the long haul. The minute you stop advocating, the industry pushes back and you make one step forward, 2 steps backward. But don't get scared. It's important, as I said, that's where the money is and we need the money.
Thank you. That was a very passionate defense of tobacco taxation. And now I don't think it's a very difficult question, but we do have an upfront question from Kurt, who comes from Belgium, who is asking Kylie, in Australia's drastic increases in tobacco control tax, has that always resulted in increased revenue? What's the end game on tax?
Okay, thanks. I was just typing a very long reply, so it's easier to speak to that. You're right. We have had really large increases. We had the government committed to 12.5% increases for 4 years, and then they renewed it for another 4 years. That has just finished. So we've had 8 years of that. It has resulted in big revenue numbers going to the government. I can't remember off the top of my head. It's in the billions. Unfortunately, what's happened is it's all gone into general revenue. So none of that has been earmarked for tobacco control or any health budget, actually, to be honest. So we have been calling really loudly for government to reinvest at least a tiny amount of that money. And I guess in terms of, to give you an idea, Australia's quite well known for running really hard-hitting ad campaigns on TV. They've been really successful. Well, we haven't had any of those campaigns on TV now for about 5 years. They cost around, say, 30 million to run nationally for a year at the levels that we need. And we worked out when we were doing some advocacy to the government around this, that would be something like less than 1% of the revenue they get from tobacco taxes they could put on a campaign for that amount of money. So, you know, we've now stopped advocating for tax increases because we think there's a bit of an ethical dilemma now that prices are so high in Australia, and yet the government were just using it potentially for revenue raising. It has had an impact how tobacco use has gone down and people nominate the price, but we're kind of at this strange place in Australia where we're thinking, will a further increase in price potentially have the health outcomes we want? The other thing is the industry have come back and they've managed through pricing policies, through packaging policies to undermine those tax increases. So they've done things like make smaller and smaller packs of roll your own tobacco, so they're very cheap. So people see the price of tobacco go up and then they go, it's okay, I'll just buy a smaller pack. Or they've introduced loads and loads of budget brands so that, okay, maybe I won't smoke Marlboro or Winfield's one of our big brands now, I'll go to a much, cheaper budget brand. So we now need pricing policies and packaging policies to stop the industry undermining those tax increases before we'd go put a tax increase on top. So again, one step forward, one step back in terms of the industry coming back, we keep moving on. Definitely huge money to government, had an impact on our prevalence, but not something we're advocating for again at the moment, just because there's some other things we have to sort out first.
Thank you. And I think
sorry, Anka.
yes, yes, Rachel,
could I just say one thing on the topic of earmarking, because I've noticed there are quite a number of comments on that. Sometimes how it helps to sell it, because when the Ministry of Finance gets the revenue, they don't like to give it back, and they don't like to be told where to take it. And so when you look at it as a surcharge, and so what we've done in Kenya is that there is the tobacco tax, and that goes to the Ministry of Finance, and we do get a little back in the form of an allocation to the Ministry of Health. But then we added a 1% levy that's on top of the tobacco taxes, and that is specifically designated for tobacco control. So look at it this way. You don't want to be telling them, raise 10% and then give us 2 so that you remain with 8. No, he wants his 10%. That's the Ministry of Finance. It may be easier to tell them, raise 10%, you keep that. Then collect another 1% and hand that back to us. And so the advocacy around getting the surcharge, the levy, and how you call it, so that it's actually the tobacco industry that's handing it over. And so I saw a comment by Sheila and somebody else. And so for us in Kenya, it's 2% of the tobacco industry's profits in a given year that they must hand over. And given they file their tax returns, automatically we know what the 2% is, and they hand that over. That is separate from whatever else the Minister of Finance decides is the tobacco tax, which then he can get to keep for whatever other priorities the government has. And so I think it's really important in terms of the messaging, so that it doesn't look like we are taking from them. The only person we should be taking from is the tobacco industry in that sense. And in fact, it's not even taking from the tobacco industry, it's taking from the smokers. The tobacco industry is purely a tax collector. So when they say we pay taxes, no, they don't pay taxes. Smokers pay taxes, and the tobacco industry collects it and hands it over to the government. And so I think it's critical in terms of getting the buy-in from the Ministry of Finance, so that we don't look like we are reducing what they get. But I totally agree with Kylie. I think it's a bit immoral that we collect the money and then we don't put anything into programs to help smokers quit, because ultimately we are saying we are doing tobacco taxes because it also helps smokers. So it also helps raise revenue, but it helps smokers when they quit. And so at least a small amount needs to go into smoking cessation programs. And then, as Kylie said, public awareness, because those are really, really expensive.
Thank you. I think you both made an excellent point on why it is possible and how it is possible to engage in tax advocacy without being a tax expert and while being a public health expert. And I think, I hope this is encouraging everyone with us today or watching this dialogue later to be bold and engage in that discussion and find that that support. And I just like, I'm realizing we're reaching the end of our time, but before we do, I'd like to just ask John in a minute to tell us, are you doing all of that stuff in your in Samoa? Are you doing that tax advocacy, and how is it working? And have you used the right tools and resources that you needed? Have you had access to them?
Yep. So for Samoa, we actually have a tobacco tax of 36.5% at the moment. But, you know, I agree wholeheartedly with the comments made by Kylie and Rachel as well. The big issue that we have is not so much taxation anymore. It's actually getting access to the funds collected for tobacco advocacy and cessation programs. I think it must be universal in that the funds collected by the Ministry of Revenue go into the general pool of funds, which they then allocate everywhere but for tobacco control. So for us moving forward, this is a big, one of the big things that we're going to really have to start to push is getting more access to the funds. And I love the idea that Rachel's put forward of a levy on top of the tax itself, that we can actually say, hey, look, you know what, let's put this towards tobacco control and cessation plans. Just quickly touching on that, when tobacco tax was added, which increased the prices of a packet of cigarettes in Samoa, we actually saw the numbers of smokers start to drop off. And the tobacco companies locally came back and did exactly what Kylie said, was they reduced the size of the packaging that they were selling down to 10 sticks from 20 that they had. So while the price increase was there, but they tried to make it still accessible by just reducing the packaging sizes. So yeah, and again, it's a learning curve that we need to stay on top of, not just advocating for the actual numbers itself in tobacco tax, but looking at all the impacts that come with it, and especially in the reaction from tobacco companies themselves. So I'm just really encouraged by the information that I'm gathering here this evening and how we can put some of these ideas into focus in the near future.
Thank you. I am minded that, well, it is 10:31 and everyone is still with us. So thank you for bearing with us. It's a very interesting conversation. And what's really interesting is that we ended up being going into depth in a fairly technical area, but there's clearly so many resources out there. What I'd like to say as a very quick closing remark is that, first of all, thank you to all those who have shared resources in the chat box. I would encourage everyone to save them as much as possible, but I'm sure that they will be available on the website of this dialogue or on the UICC Resource Hub. What I take away is, because we've discussed something that tends to be quite technical and maybe it creates a little bit of trepidation, a little bit of hesitation in tobacco control advocates, but it's quite clear that it is possible to engage in tax advocacy. So what I'd say is what we need to do is use the resources and the networks available. They exist. I think that's part of capacity. Connect with other organizations and build alliances, and just be bold, because if we don't do anything, that's the surest way that nothing will happen. So take action and create those necessary alliances. There's a world of resources and of organizations out there. So don't hesitate. Come back to all of us and ask for help, for knowledge, for experience, for information, and they will become available through the global and regional networks coming from advocates just like every one of us. So with that, I think it's time for me to close the meeting. I will give back the floor to Yannick, who has to announce the next virtual dialogue. And many thanks to everyone for bearing with us and for staying with us and for engaging so actively in the discussion.
Thank you, Enka, and a big thank you to the speakers actually for their insights and the conversation. So the next virtual dialogue will be in September. We will decide the topic because you decide on the topic. Every participant will decide on the topic and what we want to discuss. Today, it was really, I think that we couldn't cover building capacity for tobacco control in an hour, but I hope that you have seen there are a lot of ideas, a lot of networks and coalition to build to bring that topic to your country, back to your country. We are going to build those communities together to really implement effective tobacco control measures. So thank you, thanks a lot. Have a good evening, you, Kylie, John. Have a good afternoon, a good morning, and thanks a lot, and see you in September. Have a good summer. Thank you. Bye.